dental implants have come a long way, and the success rate is about 95 to 98%. But this success, it's totally dependent on who's providing you the implant. You have to make sure they have the experience. Experience is very important. The repetition makes perfection. You have to make sure that the dentist is providing you with this care, has a lot of experience, and they're technologically advanced in the field. So there are a lot of requirements you got to take a lot of courses. You got to make sure you're right on the ball. When it comes to placing the implant, you have to make sure you have a CT scan. Like us, we have a 3D printer. We can print the denture here. The implants are placed here, and everything is done in-house. And you have to make sure your dentist is capable of providing all of that. Implants are not just putting something in your jaw and forgetting about it. You have to make sure your dentist has the knowledge of occlusion. So what's occlusion? Occlusion is the way your teeth come together, and that process has an art and a science on its own. I have a lot of experience and know-how that teeth need to mesh in a very ideal way to make sure there isn't too much pressure placed on one part of the mouth compared to other, because that pressure can transmit to the implant and cause failure of that particular implant. So the evenness and efficiency of the bite, also known as occlusion, is extremely important. If a dental implant is failing, you feel a little sense of mild pain. You will feel a little pus, you will feel some discomfort in your mouth, and overall you have to listen to your body, because if your body is rejecting an implant, you will know, and it will tell you that something is going on. So you can't ignore it, and you have to pay attention to it. I've been practicing for 29 years. I've been in the same location for almost the whole time, maybe about 25 or 6 years I've been here. I'm not going anywhere. I have a lot of experience in that department, and we'll stand behind everything that we do. The post-op instruction is given to patients very thoroughly, and they need to follow it. And we can make exceptions if the patient was negligent on some areas. Sometimes the patient can't control the diabetes, maybe car accidents, maybe falling off a bicycle. Those are the things that patients cannot prevent and predict. But anything short of that, we are here to take care of them and make sure that they're being, looked after. So you should consider your teeth, or your implants in this case, are supporting your upper and lower lip. And if you don't have them, your lips will sink in, your cheek will sink in, and gives you the image of, like a sunken, like a sinking mouth. That is not a good look. So when you go to the dental office and you're looking to have this service done, you have to make sure the dentist has the experience, they have the technology, and they keep up to date with everything that goes on. And because the world of dentistry is constantly changing, and you have to make sure your dentist is keeping up with that. Please come and visit us for a free consultation, so you can get the smile that you always deserved and wanted.